All right, so cold stress is very important when talking about the newborn. It's part of the triad of doom. So if a baby is getting cold stress, we want to correct it as quickly as we can so it doesn't develop any hypoglycemia or respiratory distress. Some effects of cold stress to the newborn will be increased oxygen consumption, so they're going to become hypoxic and also have an impaired cell functioning. Their glucose is going to be increased. Their glucose use is going to be increased. They're going to become hypoglycemic, and they're also going to have an increase in acid production. They're going to have peripheral vasoconstriction just to help conserve their core body temperature, so they're going to be vasoconstrictive. Also, chemical thermogenesis. They're going to have an increased basal metabolic rate, which this will lead to metabolic acidosis, decreased surfactant, pulmonary vasoconstriction, increased consumption of glucose, breakdown of glycogen stores, and hypoglycemia. In the discussion, I also shared a photo along with the diagram. It's in the book, but I just posted it there as well. It goes in more detail about the effects of the newborn that it has. So who's at risk for cold stress? Pretty much every newborn is at risk. Especially a higher risk would be premature or post-mature or small gestational age, babies with less surfactant, babies are in an increased heat loss to environment. If they're unable to produce heat or if they have a greater body surface exposed to the environment, and then also the decrease of brown fat reserves to produce body heat. So that's very important. And ways the baby can lose heat, that is going to be your conduction, your convection, your radiation, and evaporation. So what we're looking for if a baby does have cold stress, they're probably going to have an increased activity level. So they're going to be crying a lot. They're going to have an increased respiratory rate. They're going to be a little bluish, cyanotic, and also they're going to have skin mottling. So you want to make sure you are always assessing the baby and looking for those signs. So it's very important to keep the baby warm. That's our main goal to prevent the cold stress. So we really want to promote skin-to-skin contact early on. The mom is the main source of heat for the baby. So doing that will be great. Having the incubators pre-warmed, performing quick baths, using external heat sources, providing an ideal environment, and also dressing appropriately. We don't want a baby to be in a cold room wearing nothing but a diaper. So as the nurse, interventions and care that we should provide to the baby would be place the infant under a warmer, give warmed air or O2 PRN. We always want to monitor the temperature frequently, and we're trying to maintain the axillary temperature of 97.8. So when this is stabilized, then we can double wrap the baby and put a hat on it while we continue to monitor. And yeah, that's it. Thanks.